We want to invite you to listen to TMI, our next episode. We have Dr. Joseph Medlin and Ryan Rampolla from our sports medicine clinic here at Henry Ford Allegiance Health. And we talk everything sports medicine.
It's awesome. Let's listen. Welcome to TMI, a podcast by Henry Ford Allegiance Health. Here we are in the studio again, Tim. I'm feeling active, ready.
Yeah, we've been doing our challenges, right?
Yeah.
Staying moving.
Yeah, the only thing that keeps me from doing my challenges is when I hurt myself.
That's not a good thing, Dave.
You know, I get about half the challenge done, and then, I can't move my neck at all,
Or you overexert yourself and
Yep.
Don't stretch properly or whatever you're supposed to do.
Yeah, this is hard to actually look at you right now.
Yeah. Your neck still hurts, doesn't it?
Yeah, too many push-ups.
Well, it's a good thing. We have some people here that can help you with that.
Really?
We do.
Who do we have?
We have our new sports medicine program starting, or clinic at Henry Ford Allegiance Health.
Yeah.
We have Dr. Joseph Medlin and Ryan Rampolla, our athletic trainer there.
Welcome.
So welcome.
Thank you. Thanks for having us.
Yeah.
So sports medicine, I know we've had some athletic trainers in schools, but we have a clinic now. And can you kind of explain for, a lot of people, we're not, I guess, the Jackson area, we haven't had a sports medicine clinic. How does it kind of all go together with like pain management, with orthopedics, with all those different practices? Where does sports medicine fit in?
Yeah. So sports medicine is a total team approach. So it fits in with everything. We do have athletic trainers in the schools like you talked about. Mm-hmm. And really, they're a good extender of what we do as far as sports medicine physicians. Ryan here is my athletic trainer, so he is in touch with the trainers in the schools, whether it's the high schools or the colleges. And we really have a good streamlined approach to providing athletes with care, whether it's through the ER direct access or getting them into my clinic or Dr. Brewer's clinic or Dr. Walper's clinic. So it is a team approach. Sports medicine is really, the management and treatment of musculoskeletal injuries, whether it's a chronic injury or an acute injury, sport related or non-sport related. We are fellowship trained and board certified in sports medicine to handle those conditions.
Okay. And you mentioned, whether it's a sports injury or a non-sports injury, because I think a lot of people hear sports medicine, so that's just for athletes.
Right.
And when I say athletes, I think in most people's head, probably Dave and mine, is like, you're in college, you're playing at a high level.
Right.
This is where I would go. Is that the case, or?
So we are there to treat the whole athlete, so everybody, not just an athlete in the schools, but the weekend warrior, the grandmother or somebody that's having a hard time moving around or picking up their grandchild. So anything that will get people moving and functional and pain-free, that's what we're there to help treat.
And I think the highlight, one big point is the high school athlete or the college athlete that we have the athletic trainers out at the school. That's actually a small chunk of our patient load. A lot of them, like Joe said, are those weekend warriors that are out running a 5K or doing their challenges and notice, that doesn't quite feel right. Yes, he's a sports medicine doctor. Yes, we work with fairly active people, but it's not always that super high athlete or that athlete that's in a high level of competition.
Gotcha. So me, when I go play soccer once a week and don't run or stretch properly, that's usually the people you're seeing.
Yeah, some of them.
Some of them, yeah. So with the high school kids or with college students, I mean, I know that you said it's a small part, but I guess what injuries do you see, that come to you? Like what's a common thing or a common theme that you see? And I guess, is it seasonal? I know everybody
totally seasonal. Ryan, I think you could talk a little bit about this.
So right now we're wrapping up high school football. And I mean, you look at just kind of what the sports dictate. Football, it's a high impact sport. So we've seen concussions, fractures, just the generic ankle sprains sometimes. I definitely think it is a lot of seasonal stuff. Now that we're slowly transitioning to wrestling, we're going to have a lot more skin stuff, not injuries, but skin pathologies will be in the office. So it's definitely
gross skin stuff.
Yeah.
happens.
It definitely is somewhat of a seasonal trend, but You always have those typical ankle sprains that come through or knee injuries. So yeah, I would say it's somewhat seasonal, but at the same time, it's definitely not so super seasonal, if that makes sense.
Yeah. And so just give a little background about Ryan. He's been in the high school setting, the college setting as an athletic trainer, the Olympic setting as an athletic trainer, and now he's my physician extender, so he'll be in the office with me, but he'll also go to the sidelines, or he has already gone to the sidelines with me, providing care right there for our schools, whether it's high school or college kids. So
that's awesome. And then I guess now that I mentioned this earlier, but that's Ryan's background. Can you give me a little bit of your background, Dr. Medlin?
Yeah. So I did my residency in family medicine, and then I did a year training in sports medicine. So to specialize as a primary care sports medicine physician. And before that, even going back in college, I did exercise physiology was my major. I also ran an exercise physiology lab for a couple of years while I was doing graduate school at the University of Nevada. And so kind of being around sports and athletic injuries has been ingrained in me since a young age. And I'm just super happy to be here in the community of Jackson to provide care to something I'm very passionate about.
So I've been doing these challenges. We have this like challenge group through Facebook here, and I kind of alluded to it earlier in the intro. Like I was like doing push-ups, and I don't know if I slept wrong or what, but like I totally had this back thing recently, and I went to the walk-in clinic. Is that kind of like a thing that you guys would do, something like that, if you hurt yourself working out or pull something?
Absolutely. Acute injuries, chronic injuries, all of that. You would call the office, and our goal is to have Ryan kind of triage these things and say like, I want to get him in today or tomorrow or in a week or whatnot. Just to give the clinic a good workflow as well. And we have I have more tools in my tool bag now to do things in the clinic with having Ryan there. So if you did have a back injury or something, we could do some manipulation in the clinic with Ryan. He's trained on certain modalities that just opens my clinic up to help even more people.
Yeah, that's awesome. Yeah, I went to the walk-in, and there wasn't too much they could do except for just be like, hopefully it gets better. Here's some antibiotics.
Yeah, well, I mean, that kind of brings it up though. Like, how do we know, so if we're sore or if we've injured something? I guess, is there any kind of indicators or anything that, just generally rule of thumbs that we could know if it's like, oh, you need to go see somebody, or you just worked out a little too hard and your muscle's a little bit sore?
Yes, that's a very fine line, definitely, to walk, because and even like in the high schools, we deal with this on the sidelines. Well, is this kid hurt, or is he injured? Like, should he be out or not out? And like usually kind of time will tell. And if it's very serious, like you can't walk, like you should probably see somebody. But if that pain's just not going away in a couple days, or with some stretching, then you should probably come in and see somebody.
And Dr. Medlin talked about acute versus chronic, which in the non-medical world, that means newer injuries versus older injuries. The nice thing about having athletic trainers at the high schools and in the college settings is that you get to develop and know your athlete a little bit more, know your patient more. I think sports medicine is a really unique niche in healthcare, because how many times do you see your physician or you see a physical therapist on a weekly basis, whereas an athletic trainer, or even when we go out to the colleges and high schools, you're seeing your patient almost every day or a couple times a week. So I think you definitely develop different relationships than you would with your normal primary care physician, or necessarily that walk-in clinic that you might go 2 or 3 times a year when you have a sniffle or a cold, or a back injury or something like that. So it's definitely a hard question to answer, I think, but at the same time, knowing and developing that sense of awareness in your own body is perfect when it comes to deciding whether that's one of those, oh, did I just work out too hard, or did I actually hurt myself?
Yeah, especially for the people who are just starting to get back into it again. It's been years, so
Yeah,
Not
definitely a
a-
transition.
You'll
not
get used to
at
it,
peak
Dave.
performance yet.
You'll get there. You'll get there. Slow and steady. Slow and steady wins the race.
Yeah.
So, is there anything that individuals or athletes can do to kind of maybe help prevent some of the injuries the most common injuries that you would see in the clinic?
I think the biggest thing comes down to proper equipment. Whether you don't think about it, but shoes are also a proper equipment that we wear every day. Shoulder pads, helmets, all that type of stuff, but also proper technique when you're doing your push-ups at home, or if you're picking up boxes off the floor. I think those are two major things you can do right off the get-go. Even goes down to tying your shoes to make sure you don't fall over. But I think those are some of the biggest things you can do to prevent injuries, but also taking care of yourself and listening to your body, whether it is, I'm having some pain while doing this lift, or I'm walking down the street and maybe I'm not walking necessarily the right way, but it's, I think it's a multidimensional approach to injury prevention and kind of preventing that stuff.
As you said, tying your shoes, I looked down and Tim's shoes are untied.
Yeah.
Yeah.
I'm not running anything in these, by the way. These are work shoes. I'm not going out for a jog.
You're going up and down the stairs, though.
Yeah, employee health might not appreciate that.
I took the elevator.
There we go.
Right? Yeah, no, I do tie my shoes properly. Trust me. I always do when I'm running. So
Yes.
I'm good there.
Good.
Oh, you threw me off now. I had a question. So, like, working with, I guess, I think about like training and working when you're exercising or working on a program or something. If somebody kind of tweaks something, how does that work? I mean, would they come in and see you once? I guess, what's a typical,
typical progression.
Yeah, like when somebody comes into the sports medicine clinic.
Yeah. So how we've kind of started to design the clinic, and really we're hitting the ground running right now because we're already getting pretty busy. So Ryan will go in, take the history, do an exam, kind of triaging and helping me to kind of focus in on what the real problem may be. And I'll go in and do the exam, and maybe it's something that Ryan puts them through a program and says, hey, here's X, Y, and Z to do over the next couple of weeks. Or we get them into physical therapy, which is also a nice luxury we have down the hall in our clinic. And then I'll typically see them back in a month, 6 weeks, 2 months, depending on or maybe in a week, depending on what the injury may be. And then follow up and see how they're doing.
Yeah, and I think we're real lucky, this being or Henry Ford Allegiance Health, all of our sports medicine team, if you want to say, whether it's physical therapy, occupational therapy, speech,
Sports medicine surgeon.
Yeah, we're all on kind of the same floor, which kind of makes a hectic work environment, but it's great because if we need to, we can walk a patient down to PT right after their visit if they're able to do that, if we can get them in right away. So I think we call it the sports medicine team, but it's really a multi-dimensional and an interprofessional team that we have. And I think we're kind of blessed to have that here at Henry Ford, which makes it great. Even if it's our friends over in Detroit, that we might not be able to give the best care possible here to our patient, but we're able to find those resources, kind of rally the troops around that patient and kind of get them back to their goals.
Yeah, we have a lot of support from Detroit, and it's nice to be able to have that kind of backup if you need it.
Mm-hmm. Mm-hmm. And it's my understanding everything's growing with the sports medicine, in Detroit, and here we're just, we keep, I guess, obviously adding a clinic, and just there's more options and more availability to patients, to us, just weekend warriors. So that's awesome.
Is there anything else you'd like people to know about what you guys do, or just somebody who's out in the community? What's a normal thing that they could just interact with you guys with, or a simple thing that they could do?
I think, I guess talking more about our capabilities in the clinic might be a good thing. Sports medicine in general, like you've said, is evolving and it's growing. With that, I think primary care sports medicine docs like myself have been really leading the charge in musculoskeletal ultrasound, and that's something I was highly trained in my fellowship to do. So not just, ultrasound's not just a modality for looking at a cute baby on a monitor, but we could use that as a very point of care tool in the clinic to diagnose or treat musculoskeletal injuries or conditions, or I use it a lot for injections. Just I know the literature says that if I use an ultrasound and I'm trained in the ultrasound, my accuracy of my injections into a joint or into a tendon sheath or whatnot is close to 100%. Whereas if you're just using anatomical landmarks, you're, depending on where you're injecting, closer to more like 70%. And so I think, knowing that we have the capabilities to use ultrasound in our clinic, and I'm not the only one using it. Dr. Brewer, my partner, is as well. And she's PM&R, but also sports medicine trained as well.
You want to explain what PM&R means?
Okay, yeah, she's physical medicine and rehab. So that's what her residency was, and then she did her fellowship in sports medicine as well. So she, has a little bit different training than I do, which is great because we complement each other well. And it just opens our clinic up to even more and more patients. So, but talking again about ultrasound, so other ultrasound guided techniques or modalities we can do in the clinic are pretty vast, and it's still growing. We will be starting up some regenerative medicine stuff, which is also something that's another conservative approach to musculoskeletal injuries or orthopedic problems, and doing platelet-rich plasma and 10X and bone marrow aspirate cell injections and things like that. It's really a cool field, and sports medicine is growing and innovating constantly, and we're staying up with it and providing that to the Jackson community, which is awesome.
Yeah,
and I think it's so we've been up and running for what? A month now, maybe a month and a half. And our tool bag is just getting larger. Our tool belt keeps getting larger and larger and larger to service our patients like you guys. And it's kind of counterintuitive. We hopefully can return our patients back to a better level of function before they came to see us. And I think it's great having our athletic trainers out in the community, working with our high school athletes. And frankly, those are some of the best relationships our healthcare organization is going to have with anybody. And they're just not out there for, back when I worked in a high school, you were there for the teachers, you were there for friends, you were there for family members. And it's great to have those working relationships with our patients. And that only adds to our tool bag of kind of, in my job, is kind of the go between our folks out in the community and Dr. Medlin and kind of our sports medicine team. Which I think is just great, and we're only expanding. So it's going to be great to see where we are in another month.
Yeah, it's pretty awesome, and it's great to see you guys out at like the games and like just out in the community, like connecting with people, being there.
Yeah, that's a fun part of our job, is definitely being out there. But it's also given a good backup for our athletic trainers. They're highly trained in triaging emergency situations on the sidelines. But I can't speak for Ryan, but as a trainer, does it make any difference when a physician's there?
I think it helps. It adds some oh my gosh, I can't even talk. Reassurance. But yeah, so it adds some reassurance. And also it's great to have somebody that, as an athletic trainer, our skill set is pretty vast, but there's certain things that we can't do just due to state laws and practice acts and stuff like that. And where that ends, we have someone that picking it right up. So it's just providing a better service, a better health care overall. And we have a continuance of care. And yes, we see him on Friday night, and yes, it's cold and it's great to see him there. But when you get him in the office, sometimes that whole eval process and everything takes on a new life, and you get to see that patient interact with them. And I'm thinking back, we saw a patient in our office last week, and then we saw him again on Saturday, and we saw him again out on a football field. So it's great to continue those relationships with the patients. And it's great to see them back out on the field and make a big hit or make a crucial play or kind of whatever their goals are, it's getting them into achieving that. I take a lot of pride in that, and I'm sure Dr. Medlin does as well.
Yeah, not just our athletes reaching their goals, but the everyday weekend warrior and the child that's suffering from his concussion from gym class, or grandma that is having a hard time lifting a grandbaby or whatnot. And our goal is to help our patients reach their goals, and that gives us a lot of motivation to continue doing our jobs well.
Yeah, and sorry to kind of jump on this though. I know you mentioned concussions. We haven't talked a lot about it. Everybody hears about concussions in football. I mean, they kind of expect that. I guess how are we dealing with it? How are we working with our athletes, I guess, to address concussions?
That's a great question. And by the time this is probably published, there's going to be a new research article and a new management technique. And, but that's evolving. And Joe and I constantly are researching new ways to treat those and get baselines and monitor symptoms. And kind of the golden right now is a Buffalo protocol, which allows us to kind of see and track where the athlete's level of function, or that the normal patient's level of function is when they first come see us, and that gives us kind of a guidance tool to progress them through the stages of recovery. Going from there.
So yeah, concussion is evolved constantly, and it used to be that you would wake kids up every 2 hours when they're trying to sleep after their concussion and make sure they're okay, but that all's been kind of debunked as a myth and not really a thing.
The classic term is cocoon therapy, which, it has been.
I remember that in high school.
Yeah,
so that one I do remember.
Yeah, so that's generally a myth, or it's not a thing anymore. Concussion has. We have a protocol with our athletic trainers that once they are symptom-free, then they go through a general return to play progression for 5 days. And that's all guided by our policies with our trainers in the schools. And we see them either in the training room. So we do go to the training rooms, like at Spring
using the word
University.
Athletic trainer there, Joe.
I know.
Athletic trainer.
So it's either guided by us and, Ryan and I kind of extending out to the schools, or, and then they can progress with the athletic trainer as long as things are going okay.
I guess the biggest thing probably is each athlete's different.
Yes.
I mean, I know I've never had a concussion myself, but our niece, who is a cheerleader, it got dropped.
Yeah.
So, I mean, it's not just football where you get concussions. I mean, that's obviously the biggest one that people see. But I know it took her 6 to 8 weeks to kind of get back to normal.
Yeah, it's
especially a first-time concussion. The younger you are, the longer evidence says that it's going to take for you to recover. There's some cool stuff, and Ryan kind of alluded to the Buffalo protocol, but newer research is coming out that's saying, we want to get these athletes moving soon, even after a day or two of them being concussed, and in a safe manner, whether it's just some aerobic exercise, definitely not contact, to prevent a re-injury to the head, but newer research is coming out saying we want our kids to move safer, not lose their conditioning, but exercise at a level that doesn't flare up their symptoms, but and something definitely guided. So that's what the Buffalo protocol helps to achieve.
Yeah, and you kind of alluded to it. All concussions are different. All patients are different. And even if it's a grandmother that was in a car accident, getting to the right doctors, like a sports medicine physician, is kind of crucial in that, because yes, waking somebody up every 2 hours is great to make sure they're okay, but when sleep and the inability to sleep is one of the symptoms we track. When you're waking them up every 2 hours, it's kind of hard to
counterintuitive.
Yeah, it's counterintuitive for it. But getting in, kind of developing that relationship with the patient, I think is definitely a big one to understand how and what we're going to do to best address the needs of that patient and that injury or that pathology we're seeing.
Awesome.
Great.
Thank you, guys.
Cool. Yeah, it's great to know that like you guys are so into this and like helping people like perform their best, like the athletes out there, but then also that service is available to the community members who just, are like us.
We're a little bit out of
Don't know any
shape
better.
and do a little too much.
Yeah,
That's basically what it comes down to.
it's very cool.
Definitely.
So
Yeah. So thanks for coming in today, and I'm sure we'll have information about how to contact you guys on the website here. And
Nice. Yeah.
Absolutely. Thank you for having us.
Thanks
Yeah.
for having us. Yeah.
it's been fun.